Okay, today we're excited to have you all here, and this is the Family Exchange. Welcome to our session today. We're talking about family peer support for kinship families, and we're so happy that you took the time out to come and out of your busy schedules to come and join us for this. But before we get started, if you wouldn't mind putting in the chat a little bit more about you. We would like to know your organization and your role and where you're located. That really helps us know for marketing purposes where we need to hit harder to get more people to join us. So if you would put your name, location, and your organization and your role in the chat, that would be very helpful. Okay, thank you. So as part of our session, we have to provide this disclaimer. The presentation is prepared by NTAC under a cooperative agreement with SAMHSA. While this event is supported by SAMHSA, the contents are those of the authors and do not necessarily represent the views of SAMHSA, HHS, or the US government. Next slide. In case there is an emergency, we hope there won't be any security issues, but just in case, our Zoom connection will immediately end and you'll receive an email to join or rejoin a new session. So just in case, I've never had it happen, but just in case. Next slide, please. These are all of our wonderful partners in NTAC who have come together to utilize their expertise and subject matter knowledge and help to inform the field by creating products, resources, and sessions like this one to enhance behavioral health and mental health fields. Next slide. As a center, our vision is that all children, I'm trying to get my slides into place, that all children, youth, and families living with and impacted by mental health challenges will have access to the resources and opportunities they need to thrive in a comprehensive and equitable system of care. We serve a wide cross-sector audience, including everyone from state leaders to providers to school workforce, infant and early childhood providers, community-based providers and peer supervisors, family partners, youth partners, and much, much more. And while I'm on this, knowing our vision and our services, I just want to make sure that we recognize those in the Nashville area who are enduring a horrific tragedy yesterday. And so if you're from that area, please know that our hearts and minds and prayers are with you. Next slide, please. So look for a follow-up email after this session. We wanted to address some of the commonly asked questions that come up during the session to let you know before we get started what you can expect. So in the follow-up email today, you'll receive a certificate of completion, a link to the recording of this session in case you have to miss part of it or you started late, and a copy of the slide deck or the presentation from Karen and Kelly will be part of that email as well. So a reminder was sent out to you earlier today or yesterday of this session, and it also included a copy of those slides if you need to access them while we're having this presentation. Okay, next slide. So welcome to today's session. We're excited to talk about family peer support for kinship families. And it's a part of a session that we're trying to do throughout the year is what different parts of families do we need to recognize, and today we're recognizing the kinship families. So welcome to this session, and I'm very excited to introduce to you our presenters for today. Karen, you can go to the next slide, Karen. Karen Duffy is the Chief Program Officer at the Maryland Coalition of Families, and Kelly Ellison is a Kinship Navigator for the Maryland Coalition. I can talk, it's only Wednesday, right? Maryland Coalition of Families. I'm going to turn it over to Karen and Kelly, and I will monitor the chat for you so you guys can go ahead and do your presentation. Okay?
Great. Thank you so much, Lori. Really appreciate it. And thank all of you for taking time out of your day today to join us. As Lori mentioned, I'm Karen Duffy. I'm the Chief Program Officer at MCF here in Maryland. We are Maryland's statewide provider of family peer support. So we are working with families in Maryland who have mental health, substance use, or problem gambling challenges. We're working with those families for systems navigation, resource connection, and most importantly, that one-on-one emotional support. We have about 65 family peer support specialists in all 24 Maryland jurisdictions, and Maryland is a much bigger state than I ever thought when you think of it that way. We were just discussing before this session that Kelly and I work together very closely, but we don't actually work together very closely. We are on opposite sides of the state. So when we talk about 65 folks spread out through the state of Maryland, that's really a lot of people covering a lot of ground and a lot of families. So today what we would like to do is just give you an overview of what working with kinship families has been like for us at MCF. It's somewhat of a new endeavor, and we'll talk about that a little bit when we get into it. But first, we wanted to just kind of do an overview of kinship families and what that looks like. So we're going to talk about different kinds of kinship care providers, some of the benefits and unique challenges that our kinship caregivers face. We'll talk a little bit about the Family First Prevention Services Act and how that's impacted kinship families. And then that discussion will lead into us talking a little bit about a pilot program that we're working on with our Department of Human Resources and Social Services Administration here in Maryland. But before we get started, we'd like to do just two really quick polls because we just want to get a sense of who's in the room and to give each other a sense of who your colleagues are in this space today. So if you notice, I think up on your screen right now, there should be a poll. Can everybody see that?
Yep.
All right. Oh, great. So we see it already coming in. Yes, and if you're checking other, if you could just throw it in the chat box, I'd love to kind of get a sense of what other means. So we seem to have quite a large percentage of folks who are actually family peer specialists doing the actual direct service work, so it's wonderful. We appreciate your being here, and I'm sure that you, as you'll see when we get into some of the details, you're probably encountering a lot more kinship families over the course of your work. Okay, looks like most people have answered so far, so I'm going to go ahead and end that. And yeah, and just wanted to make sure our numbers are about what we said. And then the other poll that we are interested in knowing about is just if you personally have any experience as a kinship caregiver. I think it's one of those things that really helps to inform the work, and Kelly's going to talk a little bit more here shortly about her experience as a kinship caregiver. So we are slightly over half and half. No, we're going up a little bit, 60-40 of folks in the room with kinship caregiver experience. Okay. Great. All right. Well, thank you all so much for the information. That's really helpful, and that will help inform some of the things that we're going to share with you today. I am now going to pass it over to Kelly Ellison. Kelly is a kinship navigator for MCF. She is our resident expert on all things kinship, and she's going to lead you through some of our next few slides to talk a little bit about her work at MCF and some of the things that she's seen. Kelly, you want to take it away?
Thank you, Karen. Good afternoon, everyone. I am Kelly Ellison. I am a kinship navigator for Maryland Coalition of Families. I also have lived experience as a kinship caregiver. I took in my cousin's children through both informal and formal kinship caregiving arrangements. So like many of you in the audience, I do have that lived experience, which is also a requirement for working at MCF. So many of you in the audience already know what is kinship care, and that is the care of children that are not biologically your own. When those children are unable to be cared for by their biological parents, then they are placed into the care of their relatives or someone else that is able to care for them. Next slide, Karen. A kinship caregiver does not have to be a biological relative, like a grandparent, aunt, or sibling. A fictive kin can be also a kinship caregiver, someone that is a coach, a clergy member, another close family member that is very well known to the family can also be a kinship caregiver for that particular child. We're seeing that a lot more here in Maryland.
So it's an interesting statistic to think about, that 3% of all kids in the United States, about 2.6 million, are in kinship care right now. And that number has fluctuated between 3 and 4% over the last few years. We think, and evidence suggests, that the reason that kids are coming into kinship care for now, it's due to the death of a parent, a parent's incarceration, substance use. We're finding that because of the pandemic, a lot of our kids are coming into kinship care because they've lost a parent to COVID. So we're seeing a lot more of those kinds of things. But it's also important to note that we think that these numbers are probably not representative of really the true number of kids in kinship care, because a lot of families, it's an informal arrangement, and they don't necessarily reach out to their local Department of Social Services to ask for help. And that's typically how that data becomes known and counted. And some families don't want to reach out, right? They just kind of want to do their own thing and take care of their family and the kids, and they don't really want to draw attention to themselves, because sometimes there's other implications for their involvement with social services. So it's quite likely that number, that 2.6, that 3% is an underrepresentation. But some things that we know about these kids that we know about that are in kinship care, the largest percentage of them are ages 1 to 5, which, as we all know, are some pretty formative years. There's some lots of things that happen, lots of development and growth that happen to children at that age. And so depending on the reasons for why they're coming into kinship care at that point, there could be some serious trauma that has to be managed and dealt with. The next highest is that 6 to 10-year-old range. And again, these are pretty formative years for our kids. It's when they're starting school, when they're sort of starting down that path of education, and learning and growing and making friendships. And when they have experiences that result in the loss of a parent and put them into kinship care, again, we're talking about trauma, adverse childhood experiences, these sorts of things that are long-term impacts on these kids. And then the 11 to 15-year-olds. And I just want to draw attention to that 16 to 20-year-old category too, because I think there's a tendency to think that, oh, once they're 16, they're probably going to be okay, right? But I think also this is another formative time in a young person's life, that transition from high school to college, or high school to vocation, or just getting your feet wet in testing out the waters of being somewhat a grown up at that point, right? It is still important for these kids to have really strong, stable connections in home lives at this age. So this is that, again, that general representation of where the kids that we know about are falling in the age range, but I'm not sure it completely covers everything that we'd like to know about these kids. There's also, this data is actually data relative to kids in foster care, not necessarily kinship care, but I do believe it mirrors probably the kids that we know are in foster care, in kinship care. And what we see here is that a large percentage of our kids who are in foster care are kids of color. And we find that here in Maryland as well. Our numbers in the state of Maryland mirror this very closely. And the challenge for us, as I'm sure in many states, is just the diversity across our state. As I mentioned at the top, Maryland's a lot larger than I thought. I was born and raised here, and I never realized how large this state is until I started working for MCF and managing programs statewide. But we have sort of like the outliers of our state, the western area and the eastern area are very rural. They're largely white, Caucasian folks living in those areas. And then the very center of our state, where we have Baltimore City and some other counties, right on the outskirts of Washington, D.C., are highly populated with people of color. So it's this big disparity in diversity even within our particular state. And we see this play out so frequently in the system and working with kids and trying to help families connect to services. There's a lot of resistance in our communities of color where they are mistrustful of the system. They don't believe that the system is there to support and serve them. And so a lot of our work is really centered on how do we overcome and help them overcome those obstacles. So issues of equity and diversity and inclusion are really huge challenges for us here in Maryland in the particular parts of the state that we're working in. So what we wanted to talk about today is the different kinds of kinship care. And as we did our research, we realized they call it different things across the country. And what we know here in Maryland is not necessarily indicative of what other states have. So just a disclaimer, what we decided to do was talk about these different categories, but also qualify it a little bit to say this may not be what it looks like in your state, and we recognize that. Because even as we go through this, it's not really what it looks like in our state either. But generally, these are the different kinds of situations that caregivers, kinship caregivers, may find themselves in when they're caring for children that are not biologically theirs. So this informal category, this is where we think a lot of the undercounting is coming, because we don't know how many kids are actually in informal care. Kelly, you want to talk a little bit about what informal care means and what that looks like and how that's related to that relationship with the state or with the Department of Social Services?
Well, basically with the informal care, there really isn't a relationship with the state so much. It's an agreement between the family that I'm going to take your child and care for it because you're unable to do it, and the state doesn't really have any say about anything. The state isn't taking the custody. The state they're not really involved in what's going on unless there comes a problem later on down the road. There isn't any state oversight. There isn't anything that's happening behind the scenes with any state agencies. It is, for all intents and purposes, extremely informal. And it can be extremely confusing for a lot of caregivers because they're taking someone else's child and nobody is giving them any instruction about what to do about that, because they feel like someone should be telling them what to do when they're taking in someone else's child.
Right. And these are the situations that can be fluid, right? So a parent may say to grandparents or an aunt or an uncle, can you care for my child for a while? And they do. They bring the child into the home and they care for that. But the parent can come back at any time and say, okay, I want my child back or my children back. And there's nothing to stop that from happening. And whether that's a good thing or a bad thing, there's really no mechanism legally for that kinship caregiver needs to give the child back to the family or the parent, because they still have that legal custody. And to Kelly's point too, about this idea about, okay, I have this child, now what do I do? There's no roadmap, and there are some challenges. We find families who have trouble getting medical care because they're not the parent, right? They're not the biological legal guardian or parent of that child. Health insurance and medical care and enrolling kids in school. I mean, all of these things in an informal situation can be quite challenging. And Kelly, can you talk a little bit about how you've dealt with that with the families that you've worked with?
Sure, Karen. Well, we here in Maryland, we've been able to establish what is the healthcare affidavit and educational affidavit for the informal kinship caregivers. And I presume because there's so many states that have other more robust kinship programs than state of Maryland does, that there's similar forms out there for other states. But that these forms, these affidavits, they allow the informal kinship caregivers to enroll the students into school and to take them to the doctor or the dentist without having that actual custody paperwork or some sort of guardianship paperwork saying that they have legal rights over the child, and not putting them through that court system or having to terminate any parental rights or do anything legally that way that's going to put that caregiver into what they may consider to be a bind. So it makes it a lot easier for them to get things done, and done a lot quicker. And it helps the process with the child too. So the child's not suffering in the meantime, waiting to try to get back into school or makes transitions a lot easier.
Thanks. There's also a category of this kinship care, which is sort of a mishmash of the informal and the formal. And it's this voluntary category where the parent willingly gives up the custody to a family member. Child welfare may or may not be involved in this case. If they are involved, it's usually with the agreement and understanding that this is what the parent has done in the best interest of the child. A child welfare worker may be assigned and may sort of keep an eye on things, but the state itself does not take custody of that child. And that child is not necessarily formally and legally placed in the care of the kinship caregiver unless that's something that has been agreed to. But at least in this case, there is someone from child welfare sort of keeping an eye on things. And if anything changes throughout the course of that care episode, child welfare is right there, and they can provide supports and resources and that sort of thing to the family. There may come a time that the child welfare worker will ask the kinship caregiver to petition for legal custody. And sometimes that gets a little dicey if the kinship caregiver is not quite ready for that. And so sometimes I know we have to sort of intervene and have conversations and support the kinship caregiver to say, we're not ready for that right now, or at least help them navigate that system, because that can be really overwhelming to a kinship caregiver who may have thought they were just kind of stepping in to help. And now it's turned into something that's a little bit more intricate than what they thought they were getting themselves into. And then finally, there's the formal category of kinship care. And that is exactly what it sounds like. The child is legally placed, the state takes legal custody of the child and then places that child with a family member or a kinship caregiver who has legal physical custody of that child and can make decisions and do all the things that they need to do without that affidavit that we talked about earlier. And child welfare is really the one responsible for making sure the child gets their medical care, gets enrolled in school. There may be some compensation for the kinship caregiver for acting in that capacity, so that they can have the resources they need to support the child who's formally in their care. Kelly, did you want to add anything to that?
Just when they're just based on what you just said, Karen, it just popped into my mind. When they're formal, they aren't necessarily going to get that stipend for having the child in their care unless they've been through, in state of Maryland, unless they've been through that precise class that would allow them to get that stipend. Some people think that if they have a formal kinship agreement or arrangement through DSS, that they're going to get that stipend, but they have to go through those classes first. It can be a formal arrangement and you're still not going to get paid unless you actually go through that licensing class.
So is that like being licensed to be a foster parent?
Right. It's very similar to the foster parent classes, but specifically for kinship care.
Okay, so what we know from research and anecdotally and from our own experiences, we know that there's definite benefit to having a child placed with a relative or a kinship caregiver, whether it's a biological relative, a close friend of the family, whatever the case may be. We know for certain that when they can be in a home where they're surrounded by people who know them, understand the situation that they're in, that it does minimize the trauma that the child experiences. And I think that's a pretty, that kind of goes without saying, right? Any child that doesn't have to be picked up and moved out of their known environment and put into some strange place where people they don't know, obviously there's going to be a minimization of trauma, not an elimination, but at least a minimization. Kelly, you want to take it from here?
Sure, Karen, thank you. Like Karen was saying, there's many benefits to a child being placed into care with relatives as opposed to traditional foster care or other placements. Many of those listed on the slide there. I have several families that I'm working with that have multiple siblings placed together that have worked out quite nicely. They have went through minimal adjustments. The siblings stay together. They are able to remain in the communities where they were already residing, able to remain in the schools that they were already going to. So, very minimal adjustments needed with the children. The caregivers themselves were requiring only little assistance in locating resources, maybe finding out what benefits they may qualify for at this point now that they have new children living in the home, possibly finding out therapy options if there were some kind of issues that may come up with the children. But one of the things I wanted to point out was kind of piggybacking off of something that Karen was saying, was that in my experience through working with families in kinship care was that no matter what the circumstances were, that over time and with the age and the circumstances with the children being removed in any case, that whatever it was that brought the child into care, there's always one thing that always seems to be overlooked, that the child has suffered a loss, and that loss is the attachment bond, that original attachment that's broken. The child doesn't understand why they don't see their biological parent anymore, why they have a new primary caregiver. And at some point during this transition, that child is going to start acting out in some way due to the disruption from that original attachment. So it just seems that all of the positives that we put into place initially and the positive things that we see here due to the placement being with a kinship caregiver, but we have to sit back and wait and make sure that that caregiver is also observing to see that the behaviors that the child is exhibiting are that they are proper for that time and period, if that makes any, if that's understandable. because there is that break in attachment. But again, attachment is a whole nother series of webinars, right? So we'll move on.
Well, and I think you make a good point, Kelly, is, no matter what you put into place to transition a child from their parents, that home, no matter how great you make that transition, no matter how smooth it is, whether they get to stay in the same school, the neighborhood, the friends, everything stays the same. The one thing that's not the same is probably one of the most important things, and that is the connection to their parents. And so I think you're right. I think caregivers need to be very sort of in tune with what's happening with the child, what is acting out behavior, what is behavior appropriate to their developmental age, right? These sorts of things. And a lot of times our caregivers don't know that, right? It's been a while maybe since they raised kids of this age, and things have changed. Life is very different. And so I think, we spend a lot of time really supporting those caregivers to help them, figure out, is this something we should, get on top of right away? Is this a problem? Is this an issue? Or is it just sort of normal developmental kinds of behaviors? And that can be tricky. It's really tricky to try and tease those things out. And I just wanted to go back to something I said earlier about those older kids. We think that transition from the parental home into the caregiver home is rough for younger kids because things are different, but I don't want it to be lost how difficult that is for older kids too. I think sometimes we make an assumption that older kids will be fine because they have more of an understanding of what's going on. But again, when you're a teen and you think about your image is everything, and on social media everybody's life is perfect and wonderful, and here your life behind the scenes is not so perfect and wonderful. That discrepancy can cause older children, older teens, a lot of just a lot of trauma, a lot of unhappiness. And again, having a caregiver be able to watch out what is a normal teen response to something and what is something that's indicating that something else might be happening with that child, and then finding the necessary resources.
Can I just say something? I know in my experience working with kinship caregivers, they think that if they can love this child enough, they can love them through this behavior, but that because they don't understand what it is, they don't. So they need a whole lot of support and to get through that period of time, because sometimes you can't just love them through it. It wasn't for a lack of love that they behave that way.
Right. You've said something truly valuable there too, because it's not just they want to love them through it, and that's beautiful, that's brilliant, but at the same time they need to understand that these behaviors are there for a reason, like Karen was also saying. And then there's the whole issue of that there's the generational divide. How they raised this grandchild's parent is not the same way that you can raise this child, because absolutely everything has changed since you raised this grandchild's parent. So you're retraining the grandparent on how children are raised in this day and age, and then they look at you like you have three heads, because why would you know how to do that? And teaching a grandmother how to use TikTok is like the most interesting thing in the world to do, because they just think that is just the devil. But yeah, it's all encompassing. They just want to love them through it. They think the more love that you can throw at the problem, it's going to go away. And if it were that simple, then all of our children would be healed. Well, the majority of them would be healed, because, that's what
love our children.
Yes.
Somebody said from the chat that Kyle Delaney said that some states use a comfort call between parent and new caregiver, and if appropriate, the child, as soon as possible after the removal. And this provides an opportunity to share a lot of personal information of the child for the parent and the resource parent to decide what to tell the child for the reason of suddenly not being in their home. So I think I like the comfort call. I think
Yeah.
that's a good idea.
Yeah, I love that. And I think that, you know, we talk about early intervention, right? We talk about prevention, but at this point, you know, any early intervention strategies that we can employ to help sort of smooth that transition, but also prepare the caregiver to see that it's lovely that you want to love this child through it, but here's the things to watch out for. And when you've encountered these things, there's support there for you. I love that idea. That's wonderful. What we also know is, again, is as well-intentioned as our caregivers might be, there are certainly tons and tons of challenges, that some that they may anticipate, some that they might not. And a lot of things for them to think about. And this is where Kelly and her team of other kinship navigators come in to support the family. So I'm gonna let her take this.
Yeah, unfortunately, the challenges there, you'd like to see that there weren't that many challenges, but there are quite a few. You know, the kinship caregivers, they provide such loving, stable environments for these children. They're trusted caregivers for these children. But there's so many unforeseen issues that arise with these caregivers. The caregivers, like we were talking about earlier, they're not taking a class. They're not signing up like your foster care parents to be on call to take children at a moment's notice. They're getting a call sometimes in the middle of the night to take these children that are showing up with the clothes on their back and nothing else. So when that happens, they realize, or the children come in and they're in these situations where they don't know what to expect. And before they know it, they're sitting there, if you're working with grandparents, and they're, 3 years later and their retirement fund is pretty much drained, and they're looking for a part-time job while the grandkids are at school. So, these feelings that they start to have of resentment and guilt and shame, and, the guilt and shame just at why am I raising my child's child, and the guilt and anger over the entire situation, it really starts to eat at these caregivers. So one of the first things that I like to do when I start seeing these emotions coming up with my caregivers is letting them know that, you're entitled to your emotions, and your emotions are all completely valid. You weren't expecting to do this, and there's no reason to beat yourself up over what you're feeling. Let's work through it and figure out how to get through these feelings, these things that you're feeling, that it's okay to feel what you're feeling. You're allowed to. And also letting them know that I've been there. I've felt exactly how you feel. That is huge for them, because for them to be able to actually be in the room or even be on the phone with somebody that can tell them that there is another human being that has felt as horribly hateful and mean towards somebody else, it's huge for them. They just, it's very big. So these challenges it's something that we work on a regular basis. They are definitely, it's huge. The loyalties, the biological parents coming back and forth, the grandparents sending the biologicals back. But there's another thing that one of the more difficult things besides the emotions is the changing of roles. With grandparents in particular, the inability to be able to understand or acknowledge how their roles are changing when they're taking these children into their home. There is this issue where they still want to be the grandparent. They don't want to step out of that grandparent role and into a parental role, because that's not what they intended their life to be. So we spend a lot of time educating grandparents and other caregivers about what this looks like or what this needs to look like for this child, because this child has lost their biological parents in this relationship or in this transition. And this child doesn't need you to be a grandparent at this point in time. This parent needs you to be their parent. You can still be a grandparent, and we have to talk about what does that new grandparent relationship look like? And sometimes we set up a plan. You can be a grandparent on Saturdays from 12 to 9 or whatever that looks like for this particular family. So we have to look at these transitioning and changing roles. And a lot of folks are hesitant and they buck that system quite a bit. It's very difficult. One of the other things that I wanted to point out was one of my more difficult kinship families that I work with in the situations is generational trauma. I know we've talked quite a few times today about trauma and trauma-related issues, but something that it runs rampant in kinship families is generational trauma and how we need to work to treat the family. We can't just treat the children. When you run into these situations where you're seeing that the families aren't making forward progress and the children aren't making forward progress, and you step back and you look and you see that it's due to this generational trauma, and you're spending more time in figuring out that it's the entire family that needs help, and you're teaching all of these additional parenting skills and all of these different social skills for the entire family, not just for that caregiver. So these are just a lot of the challenges that I see in the work that I'm doing.
No. And I think what's key here too is that when you're talking about the guilt, the shame, the anger, the resentment, a lot of times all of those things are swirling around all at the same time. And you start to feel guilty at being angry, right? Or you start to feel guilty that, how did this happen? How did we get here? What did I do to help us get here, right? And so teasing those things out and figuring out what strategies, what resources are needed, that can take a long time. And so Kelly spends a lot of time just sitting in a room or on the phone with these folks, just trying to help them tease out what's the primary thing that we need to address in this moment, because you can't deal with it all at one time. And even if you sort of address these things, it's cyclical and it's a roller coaster. It's all over the place all the time. And so a lot of what we do is a lot of listening, we do a lot of self-care with our families, and we all know we talk self-care all the time. It's more than just going and getting a massage or a manicure. Like, there really has to be that separation. I like what Kelly talked about with, like, these are the hours that I'm going to be a grandparent, and we're going to go to the zoo, or we're going to go to the movies, or we're going to go do something fun. And that's how we're going to spend that day. But there needs to be an equal amount of time too, in which they can just be not anything in that moment, right? Stepping back, being able to separate, having alone time or time away is as critical to our families and their success, as well as the success of the children in their care. Okay. So we've hit on a little bit of these things, but I know Kelly spends a lot of time looking at her families, doing assessments, and trying to figure out what exactly is it that her kinship caregivers need. So Kelly, why don't you take it away?
Sure. When thinking about what they need and what will help them make forward progress when they get stuck or have other needs arise, the first thing that comes to mind is always education and expectations. If they know what to expect, where to find benefits, what benefits they may be eligible for, what they can expect, even right down to what they can expect from their new living arrangement, even if someone can tell them if reunification with a biological parent is a possibility or not, then your kinship caregiver is going to be in a lot better position and have a much better perspective over the whole situation. In my area, the main request I get from virtually every kinship caregiver is respite, and that's just not available for informal caregivers. So we offer support groups and family fun events, and I know it's not the same, family fun events and workshops and events specifically geared towards kinship caregivers so they can come together as caregivers, meet other families that are like them, allow the children to socialize with other families like theirs, and most importantly, give the children an opportunity to meet other children like them, children that don't have a traditional two-parent household or even a divorced two-home household, and let them know that they're not the only ones.
I think one of the things that we see too is this idea, especially with our grandparents who came up in a different generation, right? Where mental health wasn't something you talked openly about. And so now that they find themselves in this situation where they're incredibly, they're facing this future that is incredibly different than the one that they thought that they were going to be leading at that age in their lives. The go-to is not, okay, I need to find myself a therapist, right? Or I need to think about what other kinds of mental health supports that I need. And they may never get there, and that's totally okay. But that's why Kelly spends so much of her time trying to figure out, how do we help families feel connected and less isolated and less alone, and the children as well, because sometimes that might be all that they need. That might be at least something that they didn't have before. And so we think a lot, we spend a lot of time thinking about what our programs for families look like, not just our one-to-one services. Okay. I want to move on. Just we'll take this next part pretty quickly, but I want to talk a little bit about the Family First Prevention Services Act, which is a mouthful, and how here in Maryland we're sort of taking it and using some of that funding to make some improvements in our Department of Human Services. As we know, this act in 2018 did a lot for child welfare reform, but specifically for our kinship families. It really made it easier for kinship families to take children in, and that to make that transition for the children much more smooth. And it made it more, I don't want to say inviting, but it made it more welcoming for the kinship caregiver to want to do that, right? So the idea was, if the child can't stay in the home with their parents, the next best thing is keeping them connected with family members, extended family members. How do we make that happen in the least disruptive way? So that's a lot of what this act was about. And so here in Maryland, we sort of took that, and right now we're in a pilot study, because what we've seen here is we actually have seen an incredible increase in kids going into kinship care. Maybe it's because of this act that sort of made it easier for families to do that, or because there's benefits now for families to acknowledge and identify as kinship caregivers. And so I don't know if this is really an increase in terms of number of kids going in. Maybe it's just we're counting better here in Maryland. This time period, though, where we had this increase just happens to coincide with the pandemic. So there could be there's definitely some connection there. We have to all just acknowledge that COVID had something to do with everything. So back in 2019, 2020, our Department of Human Services, our Social Services Administration, came to us and said, we want to pilot a study in which we're going to look at kinship navigation that is provided by a person with lived experience, instead of someone who works for the Department of Social Services, who may or may not have kinship lived experience. They wanted to kind of get a sense of which model is more effective for families, what are the outcomes, what's working, what's not working. And so they have engaged us to do this pilot. Kelly is one of our kinship navigators engaged in the pilot. We're in 8 jurisdictions of the 24 here in Maryland with this. We have 4 staff, some are full-time like Kelly, some are part-time. They're working in partnership with their local Department of Social Services. The University of Maryland and Chapin Hall are involved, and they are looking at what we're doing here, so that it can hopefully someday be deemed a best practice. And so this is a huge initiative, and this comes from the Family First Prevention Act money services, the idea that we need to put this funding to work to improve the lives of our kids who are somehow involved with child welfare. So we started this study. I mean, we really hit the ground probably in about 2021, hired Kelly and some of her colleagues. It's taken a little bit to get it up and running, but basically what it is families come in and they get randomly assigned to either Kelly or the local DSS Kinship navigator. And then from there, they're randomly assigned, and then from there, there's some evaluation going on. And we're trying to see the traditional kinship services offered by the local department. How do those stack up against traditional family peer support offered by people who have lived experience as kinship caregivers? There's a lot of overlap. I mean, there's a lot that our local departments do that MCF also does. We all offer support groups. We all have access to helping them find, helping families find financial assistance. We help families get training on whatever topics they might need. And kinship caregivers have access to a specialist in kinship care. What we're studying, though, is if that kinship care specialist also has lived experience, does that make a difference? And we're able to offer some things that traditional local departments can't do. They have limited services here in Maryland. You're only in kinship care for a certain amount of time. At MCF, families can stay with us until they feel like they want to get rid of us, until they're just done and they say, thank you, I think I'm good. We do a lot more of that resource connection. Like I said, our services are open-ended, and we're implementing and piloting this plan builder assessment tool, which Kelly does at intake with her families. It would be lovely to say it could be done in just one session, but it can't. But it's also not like we're sitting there doing a questionnaire. It's more of a conversation, and Kelly's getting to know, what do these families need? It addresses the family as a whole, as a unit. It addresses what the child themselves need, and then it addresses what the kinship caregiver needs. So we're looking at things sort of in a vacuum, but then also holistically. And then that's what drives some of the work that Kelly does with the families. We do that at intake. We do it at the 3 month, 6 month, and 9 month mark. And then we do it again at discharge because we just want to sort of see that change over time in that progress. That's some of the differences between what we offer and what our local DSS offers that's being studied. It has not been without its challenges. When it originally kicked off and was envisioned, and we sort of had this big unveiling to the local departments of social services, I think it wasn't presented well. It was presented as an us versus them. They even called what we do enhanced kinship navigation. So there was some vocabulary there that I think the local DSS offices took issue with. So much so that we are actually getting ready to relaunch it and sort of redesign and re-envision it so that our local DSSs can see that we're still working in partnership with them. It's just we're adding some things that they don't add because they're just not set up to do it. It's just a very different model. We have a lot of issues with our local DSS offices across the state sort of acting in concert, and the community needs are different. Where Kelly lives out on the East Coast of the state is very different than the center part of the state and what the community needs are there. And the local DSS offices sort of practice and implement procedures and practices differently, even amongst themselves. So it's really hard for us to level set and figure out what we need to do when in every jurisdiction they might be doing something slightly different. And then, there's just the typical sort of attitudes and perceptions of these families and what their needs are and how we're supposed to be there, what our role is in supporting them. We've been challenged by hiring our kinship navigators. I'm happy to say that we are now fully staffed and nobody's leaving. Right, Kelly?
Right.
Nobody's leaving. But just finding people that have that lived kinship experience who also have the time to do this work. The jurisdiction that took me the longest to hire was actually the one that I live in. But I found someone, because the position was part-time, I found someone who could fit it in because the kids in her care are in school. And those are the hours that she works. Otherwise, it's really hard to find active kinship caregivers to have the time to do this kind of work. And we're really struggling to kind of get families into the system. The entry point, there's one entry point right now. It's when a family calls the local DSS. At that point of that initial outreach, they're asked if they want to go into this study, is what we're calling it, where they get randomly assigned to MCF or the local DSS. And a lot of families are like, I'm just calling to get this one question answered. And then they wind up calling back multiple times. But that initial call, they're not interested in being a part of our study. So we're trying to drive more people into it because we really want to have statewide large volumes of data to really demonstrate that the services that having someone with lived experience, family peer support, supporting these families really is the best practice. So we're still in it for about another 3 years. We're just at the very beginning. And we're hopeful that, we're going to get up and running here really soon, getting the families in, getting them served, collecting that data, and helping the university really get that research done and make that case for us. So, okay, these are just some resources that we wanted to share. These are our go-to places whenever we need kinship data or supports for our families. We spend a lot of time on these websites, and they will be included in the PowerPoint presentation when it goes out. And we're open to any questions or comments.
Somebody wanted to know if you could share those healthcare and educational affidavits that you talked about at the beginning.
I can. What's the best way to do that?
If you have them as a link, or if you have the documents themselves, you're welcome to send them to the documents to me and I'll make a link out of it, or you can just add it to your slide there, or I can put it in a link to it.
They're documents, so can I just send them to you?
Sure. And I will put the link in the email that comes out after this. It'll come out either this afternoon or tomorrow from Bridget, and Bridget will make sure that it's part there.
Okay.
So there's a question on, can the job description for your kinship navigators who have lived experience be shared?
Yeah, we'd be happy to do that. Yep. We'll send that along with the affidavits.
Perfect. And anybody else, you're welcome to come off mute and ask questions if you have any questions at this time.
I have one. I was just wondering if you have funding ideas, because we would really like to provide better support for families that are in kinship placements like what you've described today, and our funding is just really tight.
Yeah, I'm sorry, Joni. I think you said funding. Is that accurate? Yeah. Okay.
Yeah.
Sorry.
Yeah, financial. How do you pay for the peer supporters?
Yeah. Well, I'll tell you, specifically for this kinship navigation pilot program, obviously that's being funded through Family First Prevention Services money and the state. So we have a formal contract with them. And that's really where most of our funding comes from, is state contracts. We are this year, in the next fiscal year, my brain's already in the next fiscal year. We are going to start approaching some private foundations here in the state, because we know that it is becoming such a prevalent issue, especially among workforces, right? Where you have maybe folks of an older age coming and working, and now you find out as an employer that they also have kids in their care. We're seeing this a lot, and it's impacting people's employment. We see, to what Kelly said earlier, families that are retired and now they're going back to work, right? So we're trying to be really creative about our partnerships and where we think additional funding can come from. But that's true of all of our work, to be honest. I mean, like I said, most of our organizational funding comes from state and local contracts, and we really are starting to look at all the different constituents and organizations and entities that benefit from family peer support, and going to them and saying, don't you want to help pay for this? We'll see how that goes. I'm optimistic, but we'll see how it goes. But like I said, right now it is a pilot that's being funded by the state of Maryland because they are very interested in understanding kinship, caregiver, family peer support.
And if you don't mind, Kyle Delaney put in a link earlier in chat on something that he's working on. Kyle, can you tell us a little bit about that that program that
Sure.
you're piloting?
Hi. So I'm in Rhode Island. I'm on here in Rhode Island. Our CPS is called DCYF. So I'm on an advisory board for them, and recently got connected. Well, actually, I guess it's been over a year with the BFPP that I had put that link in. They're part of the Children's Trust Fund Alliance, and they do a lot of work really bridging the gap between parents and resource parents, and how to make a better relationship. And yeah, it's a lot of good stuff. So they have the word comfort call is the phrase that they use for these calls, and ideally it happens within the first 24 hours. It's for that parent and the new caregiver to kind of talk and exchange information, and make it personal, because I think lots of times from the parent's perspective, they're looking at it as this person wants to steal my baby. And then from the other side, it's like, whoa, what did this person do to mess up so bad they're getting their child taken? So it really like humanizes both sides and allows for that other family to really be a resource. It's the start of a relationship. Ideally, the child's going to go back home, and so they can exchange lots of little personal information. When the child's being removed, the caseworker is trying to get this, but it's a very stressful situation. You're going to be like, oh, I wish I had told them this, or I should have thought of that, or there's a big game next week for soccer, or they have this science fair project coming up. All those things that you can't think of in the moment. It's a chance for them to, really start a relationship with the new family. And then if it's safe and acceptable, also a chance to speak with the child. And these are the first calls are definitely monitored by a caseworker to make sure, because there is a chance things could go sideways. It's still an emotional situation, but we haven't really had that happen yet. So fortunately, things are going really well. And another part that I put in there is it's a chance for the parent to sort of say, hey, can we say like, maybe I'm sick, or I have to go away for work, or to come up with a story so that everybody's on the same page. So in a nutshell, that's it. But the link there, the BFPP, always looking for new people to join and share information with.
That's great. Thank you so much, Kyle. And thanks for letting me put you on the spot. There was a question in here: where can I find emotional resources to help caregivers that are exposed to addiction from their biological parents? Anybody have any thoughts about that? Karen? Kelly?
I mean, I gotta be honest, going back to that grandparents.org, grandfamilies.org. I go there all the time for all kinds of resources. It is such an all-encompassing website that I think it really touches on a lot of different
We have a very strong grand families here in Utah, so I also would recommend them highly.
Yeah. I have not gone to that website and not found what I was looking for ever.
There's another comment that New York State has a strong kinship navigator program. They also have limited respite funds through the New York State Caregiver Coalition. Programs have to apply for the grant. The New York State Kinship Caregiver Program does monthly lunch meetings, which are taped and you can access on their website if you can't attend. So check it out. And then there's the link to it also in the chat.
I love that. That's great.
Yeah. Yeah. And April's been wonderful of putting links in here. So thank you, April, for doing all of that.
I saw that.
And
Thank you,
we'll
April.
definitely, Bridget will include those in our email, our outgoing email when we, at the end of this. So any other questions? Let's see, there's another message here. Okay. So are there any tips supporting the non-custodial parent?
I think when working with the non-custodial parent, you have to work it the same way that you do with the custodial parent. I mean, I don't see that in my mind. It's just my own personal opinion. I don't view that any differently than I would with a custodial parent. I see that as meeting them where they're at, and you're still going to view that as a parental relationship where you're going to honor that relationship as much as you would any other parental relationship. But it's obviously going to depend on each individual situation. What are the circumstances surrounding the removal of the child? What kind of, is it a reunification situation? What kind of interaction is there supposed to be between, or is there to be between the child and the non-custodial parent? There's a lot that can go into that without knowing specific circumstances. But only because they're non-custodial, I don't think that it necessarily needs to be treated that much differently, in my opinion. I don't know if that answers the question, but I don't know if I'm getting hung up on the non-custodial portion of it, but I don't know.
Was there anything specific there that you were interested in, Melody?
Actually, I reposted it. My boss posted it in the chats earlier on, and I just reposted it. So,
Okay.
Patty, is there anything else that you would like to know?
Yeah, well, I was thinking more about sometimes there's a conflict, or it feels like a conflict for staff to support both the grandparents and the parent. And I agree with your answer that I think everything should be the same. And coming as a parent who used to be a non-custodial parent for a while, I really appreciated the organizations that were able to reach out to me and let me know what's going on. And so I just kind of wanted to hear how you guys are sort of managing those boundaries, I guess is probably a good way to put it, and just anything that could.
That's a great question, Patty. Yeah.
Well, we work directly with the caregiver. So we do not have interactions with the actual parent in these situations. We don't have interactions with the parents at all. So what I do is, if the caregiver is having some sort of difficulty or comes to me with some sort of issue that may arise with the parent, then I can sit down with the caregiver and walk through what these different scenarios may look like, and work out different ways that these different scenarios can be handled. But we do not work with anyone other than directly with the caregiver, unless, of course, that caregiver were to give us implicit authorization to work with someone else. Then we can reach out to other folks. But typically it's caregiver, us to caregiver direct interaction.
So do you help them though come up with some kind of a plan on those boundary issues?
I do a lot of work with my caregivers on boundaries, how to navigate those boundaries. And there is, in this line of work, there is a lot of work to be done on boundaries because they don't know how to navigate those boundaries. They don't know what that looks like, especially when you're talking about informal kinship care, because no
Right.
one's giving them direction. They don't know it. Is mom allowed to call Johnny at 3 o'clock on Saturdays, or are they allowed to see dad on Tuesdays at 4? Am I supposed to do that? So, you have to kind of navigate with them and guide them through what this looks like, because there isn't a roadmap for this, and they have no idea what they're doing. So, and it's hard for them because that's their brother's child or their son's child, and they're stuck in the middle. They're thrust right in the middle of this. So there's a lot of talk about boundaries, and I find myself, it's so often saying, sometimes, especially when there's animosity, sometimes you have to deal with this as if it were kind of like a divorce situation, where you're not going to talk badly about the parent in front of the child. And we're going to handle this like it was almost like it was a divorce. Okay. And then they start to come around because they can understand that, but they can't really wrap their head around what they've gotten themselves into by taking these kids into their home when they just thought they were doing the right thing because the child needed a place to stay.
I'm quite sure on that Grand Family's website, there would be articles on grandparent guilt, feeling guilty about, what happens. And
I want to mention, in case others on the call have not seen it or not taken the time or aren't aware of it, Dr. Joseph Crumbly has the most impressive, wonderful series for kinship caregivers and for professionals. It's available on the Annie Casey Foundation website. He has his own website where you can find his series. I recommend all of my kinship caregivers watch his series. I go to every one of his webinars that he has available. He covers guilt, shame, animosity, every emotion that they can possibly go through. He covers it in his series. He is absolutely fabulous, very engaged.
tell me that name again.
Dr. Joseph Crumbly.
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 Okay.
It's Crumb with Ley on the end. He's fabulous. Absolutely fabulous.
That's a great resource. Thank you.
Mhm.
There's another question. Is there ever a time limit on where the parents have no contact with the children, where the grandparents have had the children for years?
Oh, I have, I just got a new kinship family the other day that I'm working with, that the grandmother has had the children for well over 10 years. And it's an informal arrangement. And the biological parents have not been in any contact with the children at all. And it's not a situation where there's been any agency involvement. It's not DSS or CPS. No one's saying that the biological parents can't have any involvement. So each case is different. So yeah, there's definitely cases.
If those children, when they are deemed old enough, I don't know when that would be, 16, 18, wanted to reach out, would they be able to reach out?
Sure. In this particular case, that there's biological parents of these particular children, they still have custody. This grandmother doesn't have custody. She just has the children. It's informal. She just has the children. She does the required affidavits for healthcare and education. And the biological parents, wherever they are, they still have legal custody, full legal custody and parental rights. Parental rights have never been severed. So those children can reach out to their biological parents at any time.
Okay, thank you so much. That's very helpful.
Sure.
Any other thoughts or questions anybody wants to add? There were a few comments in here about personal experience and how they had experienced this themselves. And yeah, that's kind of how it goes in these, right?
Yeah.
So we will send out those additional resources. Karen and Kelly, thank you so much for sharing that. Can you go back to the slides? Because I have to do the end of the slideshow.
You're right. I forgot. Yes, I absolutely can. Give me just one second. You even reminded me of that before we jumped on here. All right.
So our next session will be Wednesday, April 26th, and we're going to be talking about engaging families in juvenile justice. We're excited for this presenter, and she is, it's going to be a good informational session as well. And if you've already registered, if you're here today, you're already registered, you'll get a reminder. But if you know of anybody who's interested or is in that thing today, or is in this situation where they have kids in juvenile justice and you think they'd be interested in this, please invite them and give them that registration link, and they're welcome to come. Next slide, please. So look today for the follow-up email after today's session. It'll either be later today or tomorrow. You'll get it from, it looks like Jay Bloom at carsrp.org. And you can get a copy of this presentation where it will be included in that. And a copy of the recording will also be there. Know that there is it will also be followed with an evaluation for this session. And that really does help us make our presentations more poignant for you and interesting for you. If you have any ideas or thoughts of what topics you would like us to cover, I'm always open for ideas for that as well. So, okay, and this is the websites or the how to get connected with NTAC. If you want to know anything about what's going on with NTAC, you can find on this website. Next slide. So this is talking about that evaluation. I already talked about that. So please take a few minutes to complete that survey. It really does help us. Next slide. And NTAC does provide free technical assistance to your organization. If you're in a place where you are looking for specific kinds of technical assistance, please reach out to the NTAC, and they will assign you to people who can help you and should be at no cost to you. Thank you so much for doing that, NTAC. And thank you, Bridget and Carrie, for covering today. We're so glad we have technical support because you can't count on me for that. And we will see you all next month. Have a great month. And thank you so much again for coming today. And thank you, Karen and Kelly, for all your work. And it's been very helpful indeed.
Our pleasure. Thank you so much for inviting us.
Okay, thank you. Have a good day, everyone.